Hey, everybody out in Maryland's beautiful 8th Congressional District. It's Jamie Raskin for my favorite time of the week, Local Hero, when we get to recognize the people who make Maryland's 8th District such a splendid and extraordinary place to live. And today I've got a really wonderful guest, Debra Wylie, who is a Maryland State Certified Community Health Worker, and she's been at Holy Cross Health since 2004 and was Program Coordinator for Health Equity. And she's focusing on the needs of marginalized community members who need help getting access to healthcare. So she's been absolutely essential during the COVID-19 crisis. But she's been involved in Silver Spring for more than 3 decades, including at Impact Silver Spring, another group very close to my heart. So for all of your work in promoting public health, keeping us safe from the disease, I want to recognize you as our local hero this first week of December, Debra Wylie.
Thank you.
And we're psyched to be with you. Tell me, where are we in the crisis? You know, there are periods where we've thought, okay, this thing is subsiding, it's coming to an end, and now it seems like we got to get right back on the front lines with the vaccines and the face masks. Tell me how you think of where we are right now.
Well, I think because you got to always remember you have people traveling in and out our area, as well as you have some community members who don't believe in getting the vaccine. And so as long as we have people who don't believe in wearing the mask or getting the vaccine, we're going to always have people getting COVID and continue to pass it. But I think Maryland really have a great grip on it. And Holy Cross, as you know, is doing vaccines throughout the county outside. We're at every corner that we possibly can be on fighting this epidemic.
And so you're actively engaged still right now in promoting vaccine clinics all over the place.
Yes.
And if people have gotten 2 shots from before, it's time for them to get the booster, right?
Yes, and we're giving the boosters as well.
Because, you know, what I've been hearing, and tell me if this is medically accurate, but what I've been hearing is that it's going to be very tough to completely vanquish this. It will be something like a flu that comes back annually or periodically, but we can basically wrestle the monster to the ground if everybody gets vaccines.
Right.
If everybody gets the shot.
And that is so true. But, you know, you're going to always have people who are skeptic, and it is just like the flu. Because as you know, we do give the flu shots as well every year. And so that evolved.
I want to talk to you about your work more generally, because I know that your work involves building healthy communities through prevention and self-care and getting support from Holy Cross Health. But what's the general strategy for uplifting the health and well-being of our community?
Well, one of the things is that making sure that you're out within the community. You never know what the community is doing if you're not involved within the community. So going to community events, I still go out and I talk to community members. I still go to different local churches, and I go to all the senior places and connect them with different services. We go to the food distribution sites and talk about and pass out information about the different programs that we're going on. And so you're constantly always in the community, trying to find out the marginal needs of the community and then bringing it back to Holy Cross, and then we work it from there.
Has COVID-19 undermined your ability to get the message out about public health, or has it paradoxically helped in that people are now more focused on their personal and family health?
It has done both. One thing happened was we had to stop all outside activities at one point because Trinity Health didn't want us to be getting sick. And so what was happening was when people were getting COVID, we were able to still help them. We had their numbers as they was coming to the hospital. We were able to, if they needed food, we was able to get food for them. We were able to get whatever services they needed. And so we started shifting our work a little bit different. Instead of going face to face, we're able to do a lot of things over the phones.
Yeah, yeah. Well, look, I hope that all of the great work you've been doing in promoting, both the masking and social distancing, along with the vaccination, makes people aware that everybody's health is connected to everybody else's health, right? And I'm just glad we've got a hospital like Holy Cross Health, which is, so directly engaged with the community. And so thank you for everything you do. And please let me know if you've got anything else you want to say to people before we break here.
Just remember to continue to wash your hands, wear your mask, and reach one, teach one, talk to one about stopping the epidemic within the communities.
Debra Wylie, thank you for all of your great work in Montgomery County. It means everything to us, and we recognize you as our local hero this first week of December. All best to you.
Thank you so much, sir.